Every day, a patient waits for a diagnosis that their lab can't quite confirm. Every week, a drug development program stalls because the evidence required to design the clinical trial is scattered across millions of published articles that no team has time to read. The answers exist. They're already in the published biomedical literature. The hard part is finding and structuring data from 18,000 journals, 39 million articles, and 4 million supplemental tables and datasets. AI tools can't reach beyond titles and abstracts, and the amount of data is simply inaccessible at scale. As a result, biopharmaceutical companies can make billion-dollar decisions with incomplete evidence, and clinicians don't always have the full picture when diagnosing patients. Dr. Mark Keel founded Genomenon to solve this evidence gap. We harnessed the power of artificial intelligence with expert human curation to build the first engine that transforms the entire library of published biomedical literature into structured, queryable, real-world evidence. For molecular labs, that means fewer unclassified variants, reduced turnaround times, and more confident sign-outs. Our two platforms, Mastermind and Cancer Knowledge Base, deliver curated evidence at the variant level, right where the work happens. For biopharma, that means a thorough understanding of the natural history of a disease, increasing eligible patients for clinical trials, and expanded labels, allowing more patients to access the right treatment. Genomenon builds custom evidence for rare diseases or precision oncology program needs, from target validation through regulatory submission and marketing authorization. Today, more than 250 global clinical diagnostic customers are experiencing significant improvements in diagnostic yield and turnaround times. And across more than 75 drug programs, we delivered traceable, regulatory-grade evidence that led to more pathogenic variants being included in ClinVar, which resulted in an increase in eligible patients for trials and expanded labels in rare diseases and precision oncology. Data that once required months or even years of manual review to assemble can now be identified, curated, and structured in days to weeks, with a greater degree of completeness and accuracy. The result, a confident diagnosis for every patient and a treatment for every disease. You shouldn't have to make critical decisions with incomplete evidence. With Genomenon, you won't.